The air in OR3 never warms, no matter how long we work inside it. The vents hum above like something breathing, slow and detached, like it's watching more than ventilating. I used to joke about that with the interns, call it the observation room for the dead, but even the jokes sound hollow now. Sterile walls flickering overheads, a silence too clean to be comforting. Some rooms don't forget what happens inside them. They just wait for you to come back. My name is Dr. Ellis Krevlin. I'm 58. I've been a trauma surgeon for 3 decades. They used to call me the closer back in my residency. Fast hands, steady nerves. The kind of guy you wanted in the room when everything went wrong. These days, I don't feel fast or steady. I feel like I'm constantly walking through molasses, trying to reach a part of myself that got left behind on an operating table somewhere I can't remember clearly. I thought I'd seen everything. Then came the man who wouldn't stop bleeding. It was supposed to be straightforward, middle-aged male, blunt abdominal trauma from a car accident, likely ruptured spleen, vitals unstable but manageable. We got him in quickly. I scrubbed in with that distant kind of focus you get after enough years, not detached, just automatic. The patient's eyes were closed when I entered. He looked pale but peaceful. No panic, no fear, just quiet. We opened him up. Spleen was gone, shredded like tissue. The rest looked clean. Bleeding was excessive, but nothing we couldn't handle. I started the usual work, ligating vessels, checking organs, monitoring vitals. For a moment, everything felt under control. Then the bleeding got worse. Not sudden, not dramatic, just persistent. Irrigation turned red too quickly. Suction tubes filled too fast. We looked for the source again and again, but there was nothing. No new rupture, no missed vessel, just blood, endless, constant blood. One of the nurses whispered, "Is it a coagulopathy?" But the labs didn't support it. Another nurse, the newer one, just stared at the incision like she saw something I didn't. I asked her twice to hand me the forceps, but she didn't blink until I snapped her name. That's when I saw it. I leaned in, trying to inspect the peritoneal folds, and there, in the space just beneath the liver, was something I still can't name. It looked like a shadow stitched into the tissue. Not a hematoma, not pooled blood, a darkness. It didn't move. Not really, but it shimmered slightly, like heat off pavement. And I swear, in the second before I blinked, it pulsed, not with the rhythm of a heartbeat, with something slower, older. I pulled back. The resident beside me asked what was wrong. I told him nothing, told myself the same thing. We kept going, clamped, sutured, rechecked. I closed him up by the book. The bleeding stopped, just like that. No explanation, no logic, just done, like whatever had been leaking had given up. As I stripped off my gloves, I looked down at the man's face. His eyes were open, just for a second. Open and staring straight at me, like he had been awake the entire time. They weren't confused or pained. They were familiar. I've seen those eyes before, years ago. Intern year, a boy, 15. Gunshot wound to the abdomen. I couldn't save him, not in time. I still remember the feel of his skin under my palms as I compressed his belly, whispering the same words again and again. Stay with me. He didn't. He bled out. And for some reason, I never told anyone that he looked at me as he died. That same look, that same knowing. I went home that night and sat in my driveway for almost an hour. I kept the engine running. I didn't know what I was waiting for. I looked at my hands and they were shaking. That hasn't happened in 20 years. The next morning, I reviewed the chart. Nothing unusual. Post-op stable. Patient transferred to ICU. Bleeding within acceptable post-op levels. Notes clean. Images normal. But when I closed the folder, a drop of blood stained the corner. It wasn't mine. The next case came and went. Days passed, but something stayed with me. I'd close my eyes, and I'd feel the warmth of fresh blood again. Not the mess, the presence of it, like it was trying to remind me of something, or claim something I thought I had buried. A week later, I passed that same patient in the hallway. He was walking now, fragile, but upright. He looked at me, stopped, smiled. "You said my name," he whispered. I paused. "I didn't," I replied. He shook his head, still smiling. "In the room, you said my name when you saw it." I walked away. I don't know what he meant. I don't want to know. I've started avoiding OR3. I tell the scheduler it's due for light maintenance. I know they think I'm being dramatic. I don't care. There's something in that room I don't understand. Something waiting. I used to believe in medicine as a shield. The precision, the process, the sterile logic of it all. But now I think some things bleed. Not because they're broken, but because they've been waiting too long to be opened. Sometimes at night, I dream of that boy. The one from my internship. He's standing in the OR, wearing a hospital gown that never quite fits. He doesn't speak, just watches. And behind him, I see others. Patients I've lost. Not angry, not sad, just present. The last time I had that dream, I woke up with blood beneath my nails. There was no wound, no injury, just blood. I haven't touched a scalpel since. They say that every surgeon leaves a little part of themselves in the people they cut. But I think it works the other way too. I think the ones we lose leave something inside us, something that waits, something that bleeds. Even in silence, you can hear the pull of skin, sutures talking to each other, under gauze, a low fibrous whisper, like fabric straining over bone. It's not the kind of sound you'd notice unless you're alone in the recovery wing at night, when the hall lights are dimmed to a soft orange, and the only movement is the slow drift of plastic IV bags swinging like pendulums. The smell is always the same, disinfectant, latex, and the faintest trace of scorched flesh from cauterized incisions. Some people say hospitals smell like healing. I think they smell like forgetting. I'm Dr. Lena Farrow. I'm 43 years old, reconstructive surgeon. My work is precision, restoration, the silent math of symmetry. They call me an artist, though I've never once thought of what I do as art. I don't create. I return people to what they were, or what they want the world to believe they used to be. But I've started questioning lately whether I'm really restoring anything, or just burying something deeper. It started with a consult, mid-30s male, quiet demeanor, clean medical history. He wanted full facial reconstruction, not due to injury. There had been no trauma. It was elective. He brought reference images, not of celebrities or digital mock-ups, just one photo, a woman's face. I recognized it the moment I saw it. A memory jolted loose like a snapped tendon. The photo was a little faded, slightly creased at the edges, not printed from a phone, but from a time when photographs had weight. I studied it for a long time before speaking. Almond-shaped eyes, faint cleft in the chin, narrow nose with a distinct tilt at the bridge, and the mouth. I would never forget that mouth. I had stitched it closed. She died 7 years ago. Her name was Emily. I operated after a hit and run. Her injuries were massive, but I tried. Hours in the OR. I was younger then, more hopeful. She didn't make it, but her face stayed with me. I see her sometimes when I close my eyes too quickly. The man in front of me asked for her face. I asked him if he knew her. He said no, said it was just the structure he wanted, said it wasn't personal. I should have said no. I should have turned him away, but I didn't. My hands moved before my mouth could answer. I told him we'd need scans, bone mapping, tissue elasticity readings. I gave him timelines, protocols, risks, but all the while, my mind screamed. It wasn't until the third session, post-op swelling nearly gone, that I began to feel like I was looking at her ghost. He didn't look like her anymore. He was her. The likeness was so perfect. I started to forget which version of her was the original. He would sit in the same waiting room chair she once occupied, his posture eerily similar, hands folded over his lap like she used to when she was nervous. When I walked into the room, he would look up slowly, deliberately, with that same small neutral smile. One day, I asked him again where he got the photo. He smiled. "You've seen her?" I nodded. "She died," I said. He tilted his head. "Are you sure?" That night, I pulled out the old case files. It took hours to find them, buried under years of digital clutter and outdated encryption. Her death certificate was there, surgical notes, my own signature at the bottom, but the photo attached, her ID, was missing. In its place was a corrupted file, static, like something had been erased. I told myself it was just system error. The next day, he didn't show up for follow-up, nor the day after. His number was disconnected. His insurance information couldn't be verified. There was no record of him scheduling the final checkup. And then I saw her, not in a dream, not in memory, in the hallway, near the elevators by Recovery A. He walked by me, in a grey coat, soft steps, eyes forward, and for one impossible second, I was sure it was Emily, not someone who looked like her, not a trick of light or stress or projection. It was her. Her scent lingered, mild vanilla and antiseptic soap. Her smile flickered as we passed, like recognition, like forgiveness, or maybe accusation. I followed, down the hall, around the corner, into the stairwell, but the stairwell was empty. No echo, no steps, just cold metal and my own breath catching. When I returned to my office, the photograph was gone, the original one he gave me, the one I'd locked in my drawer. In its place was a note, written in neat, almost feminine cursive. You remembered too much. I didn't go home that night. I sat in the break room and stared at my hands until they stopped shaking. I thought about the night Emily died, about the tear in her cheek I couldn't close, about how I told her mother she didn't suffer, even though I had no way of knowing. I thought about the mark behind her ear, a small mole that I hadn't replicated in the reconstruction. The man had asked about it, said, "You forgot something here." I never told anyone about that detail, not once, not even in the surgical notes. Some things only the dead should remember. Now, whenever I walk through the post-op wing, I keep my head down. I've started avoiding mirrors, not because I'm afraid of seeing her, but because I'm afraid of seeing me in her. I've begun forgetting the faces I work on, deliberately letting them fade from memory after discharge. Sometimes patients ask for copies of their pre-op images, and I pretend they've been misplaced. I want to forget, because I think what I do, what we all do, isn't healing, it's rewriting, and some pages don't want to be erased. Last week, I got another anonymous appointment request. No name, just an image attached. It was my face. The contours were perfect, my own cheekbones, just slightly lifted, my eyes wider, younger. The mouth was smiling, but it didn't look kind. It looked knowing. There was no number, no insurance, just a note attached. This time, make it right. I deleted the file, or I thought I did. Every morning, it's back in my inbox. I haven't slept properly in 4 days. I don't know what memory is anymore. I don't know who owns a face once it's been altered, borrowed, resurrected. Maybe we're not meant to be remembered that way. Maybe flesh is just a curtain meant to be closed. I tell myself I'll take time off, maybe stop practicing altogether, but I know I won't, because when I touch skin, I feel something deep underneath it remembering me, and I think that's all I have left. I've started to forget faces on purpose now. I think that's safer. In Overflow, sound bends differently. The walls are old, thinner, like they were made before hospitals cared about privacy. You hear things you shouldn't. Conversations from rooms that are supposed to be empty, footsteps without shadows. And when you're alone in there, which I often am, you begin to notice that silence has a sound too. Not the absence of noise, but something heavier, like a presence holding its breath. My name's Jorge Mallory. I'm 39, or tech. I set up trays, prep patients, and clean up what's left after everyone else walks out. I've worked in this hospital for 16 years, long enough to stop being surprised by the blood. But lately, it's not the blood that's bothering me. It's the rooms that no one talks about, especially the Overflow OR. They only use it when we're full. It doesn't have updated monitors or equipment, but it's technically still functional. Mostly it's just where I go to restock supply carts or dump soiled linens. I've never liked the room, Not just because it's cold and underlit, but because it feels like walking into a memory you didn't live, something unfinished. That night, we were overloaded. Multiple traumas, back to back. ICU couldn't take another crash, and OR 1 through 4 were full, so they wheeled in a patient, mid-40s male, cardiac arrest during transfer. They brought him to overflow. The monitor in that room hadn't worked for months, so they hooked up a portable vitals machine, one of the older models we keep for emergencies. It flickered on, gave a brief reading, then flatlined, battery dead. There wasn't time to switch it. I was told to prep the patient anyway. One of the trauma surgeons was scrubbing in. The man was technically still alive. Weak pulse, shallow breathing. I did what I always do. Set out tools, positioned the lights, adjusted the table. It felt mechanical, detached, until I leaned close to check the airway and heard him whisper something. Just one word, down. I paused, checked his mouth, thinking maybe he was choking, but his lips were still. The word hadn't come from the throat. It was like it came from somewhere else in the room. I convinced myself I imagined it. We started the procedure. The surgeon, Dr. Halvorsen, made the incision. Bleeding was slow. Something about the man's skin felt strange, like it resisted the scalpel, like it didn't want to open, but we continued. A few minutes in, the patient coded again. Halvorsen tried resuscitation. Nothing. Flatline. They called it. Time of death, 2:17 a.m. Everyone cleared out fast. Too many other patients waiting. I was left behind to clean, as usual. Just me and the body. And the silence. I was halfway through mopping when I heard it again. Down. Same voice. Same word. This time, it came from underneath the table. I froze. No footsteps outside. No one near the intercom. Just me, the body, and that word sinking into the air like a needle into skin. I ducked and looked beneath the table. Nothing. But the voice kept repeating, softer, like it was retreating into the floor. And that's when I noticed the tile pattern beneath the surgical bed. One square slightly darker than the rest. A different texture. I'd never seen it before. I tapped it with my foot, hollow. I didn't touch it. I couldn't. I just grabbed the linens and walked out, shaking. The next morning, I asked around, casual, like I was making conversation. Ever noticed that weird panel in overflow? People looked confused. A few didn't even know which room I meant. One nurse blinked slowly and said that room's been closed since the remodel. We don't use it. I told her we'd just used it the night before. She stared at me like I'd spoken in another language. We haven't used that room in 6 months, she said. I pulled up the logs later. She was right. No record. No patient admitted to overflow. No procedure logged. No death called. But I remember it. I remember the name on the chart. Anthony R. Briggs. I remember the suction machine failing and the sound his breath made when it stopped. I still have his whisper in my head. Down. I didn't sleep for 3 nights. When I did, I dreamed of the room. Not the version that exists now, but how it used to look. Older lights, cracked tiles, green surgical curtains we haven't used in over a decade. The dream always ends with me standing over the tile, the hollow one, and hearing something tapping from underneath. I tried not to go back. I avoided that hallway, took the long route to supplies. No one questioned me. No one noticed. Then one night I had to restock emergency linens. Only cart nearby, the one in overflow. I told myself I'd be quick. When I opened the door, the lights were already on, the bed was made, and the vitals monitor, long since removed, was plugged in and blinking. Heartbeat 73 BPM, BP 179, respes 116, no patient, just the readings, cycling steadily. Then I heard the suction machine click on. It was unplugged. I stepped back, breath caught in my throat, when I heard the voice again. Only this time, it wasn't a whisper, it was a gasp, and it was mine. The machine began to hum louder. I couldn't move. I just stood there, listening, as the readings began to climb like someone was panicking. Heart rate 124, BP 106/101. Then a new sound, something tapping, from below the tile, 4 knocks, then silence. The monitor flatlined, and then every light in the room flickered off. I must have blacked out. I woke up in the staff lounge, someone shaking my shoulder. No memory of walking there, no idea how long I'd been gone. They told me I looked pale, that I smelled like bleach. I told them I'd had a migraine. They nodded and walked away. I haven't entered overflow since. I don't think I ever will again, but I pass it sometimes, late at night, and I swear I can see light leaking under the door, like someone left a lamp on. Sometimes I hear footsteps coming from inside, bare feet, slow and dragging. Other times, it's the suction machine. But always, I hear the same word, down. I've started to wonder if the room isn't a room at all. Maybe it's a mouth, one that opens every few years, hungry and forgotten. Maybe it waits for people like me, quiet ones no one would miss. People who don't ask too many questions. People who hear things but don't tell. I keep thinking about the dark tile, how it felt under my foot, hollow, waiting. Some voices don't need air to speak. They just need a place that remembers them, and that room remembers everything. Children's wings carry a different kind of quiet. It's not the peace people imagine. It's a hush stretched thin, with waiting small, uneasy breaths, soft cries behind doors, lullabies humming from plastic speakers mounted too high on sterile walls. At night, the pediatric annex feels like a memory suspended in air, like something left unfinished. The walls are pastel yellow, the kind meant to be cheerful, but under the low lights they look sickly, faded, like they're trying too hard to forget what they've seen. My name is Dr. Max Reeds. I'm 50 years old, pediatric surgeon, 25 years in the same hospital. I've worked on newborns who never blinked once, and toddlers who screamed all the way under anesthesia. I don't have children anymore. I don't tell people that part. It's easier for them to think I just never had the time. But sometimes, I think I went into this field to stay close to something I lost. The procedure was supposed to be routine. 6-year-old girl, a minor cystic mass in the abdominal wall, harmless, benign, but uncomfortable. Her name was Amber. Brown eyes, small frame, unusually quiet for her age. She didn't fidget like the others, just stared at me with this look that felt too aware, like she knew something about the outcome we didn't. It was a late afternoon surgery, nothing complicated. We prepped her, administered anesthesia, rolled her into the annex OR. It used to be the main pediatric suite, but it was repurposed years ago when the hospital expanded. Now it's used for minor ops, outpatient work. We lock it after hours, not because we're afraid of theft or contamination, because sometimes at night we hear things in there. The nurses call them phantom monitors, machines that beep when they're not turned on. Once, a CNA swore she saw a child sitting upright on a gurney with an IV that wasn't connected to anything. Most of us just chalk it up to fatigue, old wiring, tricks of shadow and exhaustion. Amber's surgery started as planned, incision clean, mass exposed. I remember noticing how still she was. Even under anesthesia, children twitch, muscles flutter, limbs jerk slightly. Amber didn't move once. About 20 minutes in, her vitals jumped, spiked heart rate, then dropped. It didn't match the anesthesia dosage. Her oxygen saturation dipped. Her body began to tremble, violently, like a seizure. One nurse moved to stabilize her arms, but Amber suddenly screamed, wide awake. We hadn't reduced sedation. Everything had been calibrated. But her eyes opened mid-procedure, and she screamed like she was being torn in half. "She's in here, she's inside," that's what she shouted, again and again. Her tiny fingers clawed at her own chest, trying to dig into her sternum. I'd never seen a child so terrified. Her pupils were dilated, her mouth frothing, and for one breathless moment, we all just froze. Then she flatlined. We worked for nearly 10 minutes. Compressions, adrenaline, intubation, nothing brought her back. Time of death was called at 5:46 p.m. I stood there, staring at her open incision, unable to speak. One of the nurses touched my arm gently and said she knew. We closed her up, mechanically, quietly. Nobody spoke until she was wheeled out. I didn't ask what she meant. I didn't want to. That night, I couldn't sleep. I went back to the hospital just past midnight. I told myself I needed to check the file, maybe spot something we missed. But I didn't go to records. I went back to the annex. It was dark, lights off, door locked, but my badge still worked. Inside, the OR was exactly as we'd left it, except for one thing. there was a small surgical charm on the tray, silver, in the shape of a heart. Not hospital issue, not standard. It hadn't been there before. I picked it up. It was warm. I hadn't seen one like it in years. Not since our daughter. Her name was Lila. She was born premature. Heart defect. We tried everything. Multiple surgeries. I operated on her myself during the final attempt. It broke every rule, but no one else would touch her. She died on that table, and before she went in, her mother, my wife, clipped a tiny heart charm onto her blanket. She said it would keep her safe. After Lila died, I buried it with her, or I thought I had. The charm in the annex was identical. Same inscription on the back, still loved. My hands wouldn't stop shaking. I checked Amber's chart again the next morning. Her family hadn't brought any jewelry, no keepsakes. The charm was never logged. There was no explanation for how it got there. I kept it in my pocket. I don't know why. The autopsy report came in days later. Standard review. Nothing unusual, except one detail. There was an object found just under her ribcage. Foreign, non-organic, lodged near her diaphragm. It matched the dimensions of a tiny silver charm, but I still had it. I asked pathology for the item. They said there was no foreign object retrieved. I opened my palm to show them. It was gone. That same night, I saw a light on in the annex OR. From the parking lot, the room was supposed to be locked. I walked in. Amber was sitting on the edge of the surgical table, eyes open, not bleeding, not breathing. She pointed to her chest and said, "She's still here." Then she vanished. No puff of air, no dissolve, just gone. I haven't told anyone who would believe me. The nurses only say that room's bad luck has been for years. I've resigned from pediatrics. I still work the general floor sometimes. Easier cases, less emotion, but I pass by the annex often. I glance through the window. Sometimes the lights are on. Sometimes I see a child sitting upright. Not always Amber, sometimes younger, sometimes older. Once it looked like Lila. I stood there for 5 minutes, heart stuttering, watching her sit with her legs dangling over the edge. She smiled, and then the room went dark. I've started keeping a nightlight in my office, one of those old plug-in ones, shaped like a teddy bear, same kind Lila had when she was little. The nurses think it's sweet, endearing. They don't know it's the only light that stays on, even when the power flickers, even when every other room goes black. They say ghosts are angry, but the quiet ones, they just want to be remembered. Some people believe operating rooms are the cleanest places on earth, but that's only true on the surface. Beneath the bleach and the burn of sterilization, something lingers. The tile remembers, the drains remember, and sometimes late at night, when the overhead lights dim to a soft buzz, I swear the room remembers me too. Not kindly. My name is Dr. Malcolm Shaw. I'm 72, retired now, 41 years in general surgery. They held a party for me the day I left. Cake, applause, speeches. I smiled, shook hands, even gave a toast. But I knew, I absolutely knew, I hadn't walked away clean. Something from that last case stayed with me, not a memory, something heavier. I hadn't planned to take that patient. It was my final week, and I'd begun handing off all remaining cases to the younger surgeons. But then the emergency came in. Female, mid-30s, collapsed at home, suspected internal bleed. The others were in procedures. The chief turned to me. "One last dance?" he asked. I said yes. I don't know why. The chart said her name was Eleanor Vale. No prior conditions, no trauma. But when I saw her, something didn't feel right. She was unconscious, pale but calm. Her pulse was faint but steady, and her eyes fluttered beneath closed lids, like she was dreaming hard. I scrubbed in, just like always. My hands still knew the choreography. The team prepped quickly. The lights buzzed overhead, colder than usual. We began the incision. No bleeding at first. In fact, the tissues looked dry, too dry, like we weren't cutting flesh but something made to look like it. Within minutes, things began to go wrong. Her blood pressure dropped, then spiked. The suction canister filled rapidly, far faster than the bleeding should have allowed. It was too much, dark, almost black. I asked for new tubing, thinking something was wrong with the equipment, but the next set filled too. The anesthesiologist said, "She's reacting like we're not even here." I asked what he meant. "She's not under. Her brain waves are active, higher than baseline, but she's unconscious." "I don't think so." I leaned in. Her eyes opened. Eleanor looked straight at me. She didn't blink. She just mouthed 3 words. "This is yours." I froze, my fingers still inside her abdominal cavity, searching for the bleed. Her gaze didn't shift. Her heart rate, according to the monitor, was rising, rapidly, too rapidly. Then the monitor cut out. Flat line, no sound, no flashing red, just black. The entire room went still. The lights flickered once, then steadied. Eleanor was gone, but I couldn't pull my hands away, not because I was in shock, because something held them there. It was like the tissue wrapped around me. I pulled back slowly, and the feeling released, but the texture of her organs had changed, softer, slippery, like mud or clay. I looked down and saw no blood, just dark, thick fluid, not red, not even close. One nurse gagged. Another stepped away, mumbling that something was wrong with the air. No alarms went off, no code was called. We closed her up as fast as possible, even though there was no longer a pulse. When we zipped the body bag, I stood there, breathing heavily behind my mask. I should have left it at that, but I didn't. That night, I stayed behind after everyone left. I told myself I needed to write the report. Truth was, I couldn't stop thinking about her words. "This is yours." Around midnight, I walked down to the morgue. She wasn't there. Her tag still sat on the cold tray, her chart still logged, but the drawer was empty. I told security. They ran a sweep. Nothing, no footage, no record of her body being moved, no signature for release. They told me it was a system glitch, that she was likely misfiled, but I knew better. I started dreaming of her. Every night, same dream. I'm standing in the OR. The lights are off. My gloves are soaked with something thick. Eleanor lies on the table, but she's not unconscious. She's smiling, not warmly, like someone who's waited a long time to be seen, and she keeps saying the same thing. "You promised." I wake up gasping, heart racing, hands trembling. I never made her a promise. Not that I remember, but the dream kept repeating, like a broken record skipping the same line. I started digging. Eleanor Vale didn't exist. Not in our records. No emergency contact, no address. Her patient ID was gibberish. I checked old cases, wondering if maybe she'd been here before, and then I found it. 24 years ago. A Jane Doe. Emergency C-section. Baby stillborn. Mother hemorrhaged. Died on the table. The attending. Me. I remembered the case. Vaguely. We had dozens like it back then. The mother was young. No ID. No family. But I remembered her eyes. They were Eleanor's eyes. I never learned her name. She was buried under a hospital number. I read the report again. There, at the bottom of the scanned notes, was a scribbled line in my handwriting I didn't remember writing. "The body feels wrong, like she's not done. I think Eleanor was never meant to die. Not really. And maybe I was never meant to forget her. I don't operate anymore. Haven't since that day. I gave up my license before the hospital could question me. But I still see her. Not always in dreams. Sometimes in reflections. She's in the window behind me when I wash my hands. In the gleam of steel as I clean the old tools I never threw away. She's watching, waiting. I don't think she wants revenge. I think she wants me to finish what I started. But I don't remember what that was. My hands don't feel like mine anymore. They tremble at the wrong times. They itch when I walk past certain doors. Once I found blood under my fingernails, but I hadn't touched anything sharp in days. The other night, I woke up in my garage, standing, wearing my old scrubs, no memory of how I got there, a scalpel in my hand, clean but warm. I think the OR followed me home. I hear beeping sometimes from the back of the house, that soft cardiac rhythm. It speeds up when I walk toward it, and when I say her name, Eleanor, the beeping stops. Silence, then a voice soft and distant, "Come finish." They say surgeons carry their patients with them, but I think mine is the one carrying me now, and she's not done.